patients will come in and say, oh, I haven't worn shorts in 20 years or 30 years. And
well, if you're one of those folks, and it's because of varicose veins, there's some good news for you. And Dr. Joseph Protain says it's much simpler and quicker than you think.
A lot of patients are under the impression that there's nothing that can be done about the varicose veins or the leg swelling or skin discoloration, and the procedures are easier than ever. They're really usually in and out in 15, 20 minutes.
Before we tell you how they do it, I think it's important to understand what's going on in your body to get those unsightly bulging veins in the first place.
There's a series of valves in the veins. They're one-way valves that allow the blood to go up towards the heart, but are supposed to prevent it from going back down. When those valves fail, for a variety of reasons, mostly just genetics, it happens to lots of people, what's created is a venous hypertension. It's a high pressure inside the vein because the one-way valves are failing and the blood is pooling in those veins.
And that's what causes those veins to appear. And if it's not the veins that show up, you can still get swelling and discoloration too.
When there's a venous hypertension, that could cause a bulging vein. It could also cause a pressure all the way down to the capillary level. And if that's the case, you'll get more symptoms like swelling because the fluid leaks out of the capillaries, or you can even have blood cells leaking out of the capillaries, which then go into the skin and basically die and leave behind their iron. That would cause the skin discoloration.
What's so bad about that? Well, bad skin can be injured easily. You could get an ulcer, and those are hard to heal.
It's rare to have any life or limb-threatening problems from veins, but some people have a progression that just takes a few months. Other people can go years with the same appearance to the vein, but in most cases it will progress.
But there's hope and treatment, starting with what you can do on your own.
There's conservative things you can do to treat, like compression stockings. Walking is one of the best things you can do to prevent and treat varicose veins. Any kind of exercise is always a good idea.
And if that doesn't work, Dr. Protain says the treatments have advanced so much throughout the years.
Right now, what we've been doing a lot of is called microfoam sclerotherapy, and there's a product called Varicose that's commercially available for that. Basically, we inject the vein with the foam. The foam causes the vein to collapse and stick together, and it takes the vein out of circulation.
And look at some of the results. This gentleman went from this to this in just one treatment. It's really astounding. So you're not trying to make the vein work better. You're trying to make the vein not work at all.
Right.
Is that right?
Yeah, right. If we take that vein out of circulation, the blood is forced into the healthy veins. You have plenty of veins in your legs. In most cases, we can remove the offending vein or collapse the offending vein without any problems.
You're in, you're out, and the recovery is easy. All they ask you to do afterwards is a little bit of walking and get the blood flowing.
Most people are really surprised at how quick and easy the process is. There's some cases where we have to see the same patient a few times because we're limited on the dose of the sclerosant we can use. But yeah, we try to make people happy. We try to educate the patients as much as possible, and treat themselves in the future as far as preventive measures and conservative care.
So don't be ashamed at those legs this year. Shorts are the doctor's orders for this summer.
That gives you a nice appearance with no surgery. We do it right here in the office, and it's a really quick, easy procedure for everyone.